My name is Ashley. I live in Massachusetts. I am married and I have two boys, one that's 2 months old now and another that's 2.5. And I have type 1 narcolepsy. I was diagnosed probably around 16 years old. So I've been living with it for many, many years now. And I work in public health. I would definitely say that the biggest hurdle for me in making that decision to have a family was that ever since I was diagnosed, which was when I was a teenager, even back then, doctors would tell me, you can't have children on the meds that you are currently on. We just don't know enough about it, which even back then made me feel really, isolated and upset, because I always knew I wanted to have a family, but I was getting, more aware of how much I really needed those medications in order for my new reality for, living with narcolepsy type 1. I needed those to be able to function, to be able to hold a job, to drive, all of those things. So it I feel like, unfortunately, it puts women in a position where they feel like they have to choose. Do you want to choose to be able to have a job and function and feel like you're yourself with narcolepsy, or do you want to choose to have a family without medications, which I feel like is a really hard and unfair place for people to feel like they are stuck. So it really makes the decision of having a family very, very difficult, I feel like, especially at the start. So for both of my pregnancies, I ended up choosing to stay on my medications, but I went down on the dosage that I was taking in order to be able to still function and be able to hold my job. The big thing for me was I just felt like if I didn't have medications, I could barely get up, never mind hold the job, which held my family's insurance, which was a huge factor for me. So I was extremely lucky in the fact that I found an OBGYN who ended up hearing my concerns. She sent me to this amazing clinic, the Center for Women's Mental Health at MGH in Boston. And they work with women who are on all types of medications. So they sat down with me, read through all their research. It made me feel really confident in the fact that I could reduce to just one medication, and then go as low of a dose as I could to feel safe, to be able to still drive, to still withhold my job. So I did that with their help, and I took that letter to my doctors, and they all instantly were like, sure, great. This is awesome. Let's do that. That's fine. Prior to me getting that research and support from that clinic, I unfortunately always was faced with the same thing. Like, I'm a narcolepsy doctor. I only deal with your narcolepsy. I'm not going to go into the realm of OB. Or I'm an OB. I'm not going to go into the realm of narcolepsy. I don't know enough. So I can't give you a yes or no answer. So it just made you feel like you were stuck in between this, no one would communicate with each other. But once I had the ability to go to this clinic and they sent, armed me with all this research, all these different papers, it was like something just took that ease off of those providers to just feel like, okay, well, we have this proof. So it was so weird to me to just feel like all I needed was this piece of paper for people to give me that confidence that I needed to make this decision. And I do breastfeed. And they have said there's no harm in any of those things to the child. I haven't seen any issues with either child. So that's been really helpful for me to do what I wanted to do, which was breastfeed, because that was another thing that I thought, maybe I wouldn't be able to do because of the medications that I'm on. I stopped breastfeeding after 6 months with my first son, and I transitioned back to the medications I was on prior to having my first son, just because it's always been something that's worked really well for me, but it just wasn't researched enough for me to know if it was safe to breastfeed and have during pregnancy. So I went back to my full dose of that after 6 months, which was really helpful just to feel like, back to, feeling like myself again, I guess. So it was nice to be able to know that I could go down on my meds and then still come back and still feel like a normal person, even though I have probably less sleep than normal because I have children at home. But it's definitely helpful to have that medication back up to the regular dose to be able to, go on and do what I need to do. I feel like I took a lot longer to feel like I could safely have kids. I feel like that is a common story with a lot of people with narcolepsy, because you have to spend so much time finding the right providers, finding the right people that will work with you. And I found it really hard to get both sides to communicate with each other, because at the end of the day, I think they all just didn't know enough about narcolepsy or enough about pregnancy. So they kind of are set in those, their set areas. So I would say that for any provider working with anyone with narcolepsy, I know providers have limited time, but trying your best to communicate with the other side of, or different providers that people might have, especially when it comes to pregnancy, or helping them find clinics that work with people who are on medications during pregnancy. Because I feel like it's extremely isolating to make people feel like they have to choose between an essential medication to their livelihood or having their family. So knowing and letting people know that it's possible, people have done it, whether it be through getting them to support groups or getting them to an actual clinic, all of those things can be extremely helpful because people with narcolepsy can have kids, they can have kids with the medications that they might need. It just takes working with people that will help put those pieces together. Thank you, guys. Henry. Let's see if we can get him.